I'm Ali, I'm one of the physios from treatmyachilles.com. Today I'm going to be talking about surgical options when and should you have surgery or not if you have an Achilles tendinopathy. So we need to look at what does a normal healthy tendon look at, what are the surgical options that are there, and whether they are something that we should be considering or not. So a normal healthy tendon is made up of lots and lots of collagen fibres in a straight line in one big bundle, and then another and another and another bundle, and so on until the multiple bundles make up one tendon, in this case the Achilles tendon. When you have a tendinopathy or a pathology of the tendon, what's that showing is that instead of having those collagen fibres in a nice straight lines now, they become a bit more disorganised. And it also changes different things within the cells that are in the gaps in between, such as they take on more water. Now this isn't in all of those fibres and it's not in all of those bundles. So depending on how many has been affected may depend on your options for surgery. So surgical options can either be keyhole, and that's keyhole would have minimal little scars on each side, or you could have a more open surgical type of operation, and that open surgery leaves you with a bigger scar, and therefore it is less likely, it is less common to do that. What you tend to do with a tendon is something called a debridement, and that means that those fibres that aren't in that nice alignment anymore, that are a bit more disorganised, are removed, whilst those other fibres that are still nice and healthy and in those straight long lines are remaining. Now obviously this can change the dynamics of your tendon because you're removing some of those fibres, and therefore it needs to be carefully loaded and carefully rehabilitated afterwards to enable you to get back to doing different activities. Now, if we look at the evidence base about surgery, and why don't we all suddenly leap on and do this debridement and then everything's absolutely fine, is that it actually isn't the be all and end all. It doesn't have a massive success rate. What it tends to be is a last resort. So what you would want to do first is have a look at what other options you've got, which is called conservative management. And that conservative management, the best and most available treatment is exercise therapy and strengthening those collagen fibres. So the theory behind the strengthening is twofold, and we're not sure which one happens. Is it that the fibres become back to that organised fashion again, or is it that all of the other fibres around the outside and all the other bundles splint and look after that area that's been changed by the Achilles tendon? This is something that's been looked at and being looked at on a repeated basis during research. What we're looking at when we're strengthening is to strengthen those collagen fibres, and therefore we have to strengthen the muscles that create that Achilles tendon, which are your calf muscles. So this is the most important part of your treatment, and it is something that needs to be progressed over a period of time. So there's a school of thought in a recent research article in 2019 that is saying that you need to have done a good year, 9 months to a year, but preferably over a year of this rehabilitation, where it's progressively got more difficult as time has got on. And that's the important part, that you are doing more and keep progressing and getting stronger over that period of time. So if something's not going right, you have a look about what might not be happening, and you go back to that rehabilitation and you start again, or you change slightly what you're doing and you keep progressing. So if after a year of doing that progressive loading there hasn't been much change, that's an option for surgery. But there are things that can occur before that, which are injection therapy, and I know Marika has discussed injection therapy options on previous blogs and also on some other videos. So in summary, surgery is an option. It is an option that is a last resort, and it is an option done after all of the loading programs have been progressed for at least 9 months and preferably over a year.